Good day, friends of Buzzy. It is the end of the week, and it's been quite an interesting week. After feeling really compelled to share my research and intuition and sort of inside baseball on nasal irrigation, I have now been contacted by several people that make nasal irrigation products. I'm not going to put water up my nose today, but I have been doing it twice a day, and I will keep you posted on what happens with whether I develop COVID or don't. But this is one of the things I got, a 60cc lure lock syringe. This little purple guy, which is called the schnozzle, and a thing of just about a cup, 250 mLs of sodium chloride. And so to recap, if you didn't join us Monday, the bottom line is because if you irrigate your nose with either normal saline or add some extra salt, so it's hypertonic saline, you can flush out viruses. This has been tested for flu and for upper respiratory infections and cold. The thing is, flu only has about a 2-day incubation. It's really fast. So by the time you start realizing you're sick, you've already got this huge explosion of virus. The nice thing, if one could say that, about the SARS-CoV-2 viral virus is that it takes a long time from when you catch it until it progresses, and then from when it progresses to when there's serious illness. So this gives the opportunity to try to do something to mitigate the spread before it really becomes overwhelming and viral. And countries where they do nasal irrigation have fewer deaths, and National Health Service is sending out betadine and a recipe. So all of that together, I put something up my nose on live Facebook the other day. But today I tried the schnozzle, and the nice thing about actually being able to direct it is if you look at the way, it seems like if you want to put something up the nose, you want to put it straight up like that. But the reality is that just because this is shaped like a triangle, and it seems like it's a reverse ski slope that you would go in like that, and all your sinuses are up here, the reality is most of your nasal cavity is straight back. So the nice thing about this is that you really can control it without spilling and go straight back into the nares and into the nasal cavity. So I think the price of this is probably about $15 instead of about $8 for the NILMed. But at least the NILMed you really do need to have vertically to squirt it, and this at least you could do it so you're aiming straight for your nasal passages. So, not going to do that live. I'll probably do it again sometime, but not now. So today what we're going to do is we're going to talk about our Buzzy hero, and we're going to let one lucky set of child life workers know that they're going to be getting the awesome Buzzy Helps Buzzy Hero pin. Also going to be talking about, specifically in our pain fear focus, I'm going to talk about home injections and pain for patients who are taking either blood thinners like Lovenox, or people who are taking arthritis injections and they're used to doing them with the doctors and they can't. So we'll talk about that for pain, and I'm going to talk about a very specific healthcare resource for people that are overwhelmed, need some help with resilience, or are just sad and devastated that places in this country that are opening up are going to lead to healthcare workers continuing to be on the front lines, overwhelmed and exhausted. So we've got some help for them. And then I'm going to talk about new COVID information, particularly with stuff from New York and the data that dropped from their antibody tests yesterday. And we'll talk a little bit about herd immunity. So we got a lot to do. All right, so first of all, I want to talk about Children's Healthcare of Philadelphia. Alana Brewer in particular, and Melanie Hoyaski. You guys are the bomb. So Children's Healthcare Philadelphia started by testing to see whether or not Buzzy was better than a topical anesthetic. So if you go into an emergency department and you don't want to have pain when the needle is put in, they tested to see whether or not this Buzzy vibration with an ice pack put where where the IV is going to go was better than a topical anesthetic. And what they found was, and published beginning of this year, that there was no difference in pain relief. But the important thing was, if you were using a topical anesthetic, it took about 40 minutes from putting it on to getting the lab work or the IV. Whereas with Buzzy, it was about 3 minutes. So huge, important difference. And since then, Children's Healthcare of Philadelphia has been one of our best partners. They've started using Buzzy to decrease people wiggling with their vaccines because they had a problem with needle sticks, and when the patients would move, sometimes the needles could poke the healthcare workers. So they've been using Buzzy for that. And Alana also, I think, would be fine with me saying that her daughter developed diabetes, and after about 6 weeks, she was able to not use Buzzy, but she still says that one of the biggest things that helped her deal with getting the diagnosis of diabetes type 1 was that she had something that she could use for the finger sticks, something she could use for the insulin injections, and now for the CGM or for the pump placement. So if you are at home and you have to be taking injections for Humira, for Crohn's disease, for arthritis, for thick blood, for just about anything, for precocious puberty, for any of the things one might be taking an injection for, and if you're used to doing it at your doctor's office, here's what you do. First of all, it doesn't have to look like a bee. It could look like a ladybuzz, or it could actually look like a plain black one. And if you've got a kid who does not like, see, we've got some, if you've got a kid who doesn't like something cute, we've even got some rock star and googly eyeball stickers that we could put on. So just call us if you need that. But the way to do it is that the ice gives between 10 and 30% of the numbing. We used to think it was about 60, but it turns out that the vibration frequency that is used for knee pain with our VibraCools is what's behind a lot of the needle pain as well. So the needle pain blocking. So let's say that you have to do an infusion, and let's say that it's up here. So what I would do is I would take this, turn on the vibration, and leave it in place for about 60 seconds. Now, some of our units come with straps that you can use to put it on, or you can just hold it in place. When you're ready to do the injection, you want the shot near the dot. You want to have your injection as close as possible to where the business end of the bee would be, because that's where the motor is, and that's where most of the frequency gets transmitted. So you have it here, then you slide it up, and so that's the place that just got cold. That's where you're going to put your poke, as close as possible to the end of the business end of the bee, or the ladybuzz, I suppose. Maybe the ladybug butt, right there. That's where you want to put the needle. And then if it burns afterwards, then you can leave it on, or you can rub it a little bit when it's burning. If you're doing it in the stomach, the only thing you need to know is instead of moving it up, you're actually going to go sideways, because the nerves are in a pattern called a dermatome, which, if you've ever seen someone with shingles, that area is where the nerve distribution is, if they've got a little stripe. So for Buzzy, you want to move his head closer to the spine and keep the shot near the dot. So there you are. If you are doing infusions, or if you need, if you're a healthcare worker, we are doing a webinar that IGNS, the Association of Immunoglobulin Nursing, is hosting next Thursday. So look on our website and you can find information about that. All right, so you know how to do this. Just to let everybody who is at Children's Healthcare of Philadelphia know, you will be getting a Buzzy Helps Hero pin. For all of you heroes who I know are still on the job, and I also know that many of you are working 12 hours now instead of working your normal 5 to 8s. So thank you for all you're doing to keep kids safe and not freaking out, and make it the best possible for them to have to be in the hospital right now. All right, so I want to talk a little bit about herd immunity. You may know that we're in Georgia, and our governor decided to open up a bizarre assortment of places: tattoo parlors, bowling alleys, hair salons, massage spas. I have no, he must have been jonesing hard for something, for that to be what he decided to open. But this is making a lot of my people in the front lines, the other doctors that I used to work with, my friends in emergency rooms, it's making them very scared, because we know that as soon as we open up people mingling again, that's the only thing that kept the spread slow, and so the spread's going to start exploding again in another 3 weeks. So that is very scary. But I want to talk a little bit about herd immunity, because what we have kind of decided to do in this country by default is that we're just going to let everybody get exposed sooner or later. And if too many people are dying at once, if we're overwhelming our ICUs, then likely the regulations and the sheltering will start up again, and people will have to be back staying at home. But there are a couple things to know about herd immunity. First of all, the biggest and best trial to date came yesterday from New York. The results dropped, and they looked at about 3,000 people. It was a very good random assortment, and found that about 20% of the people who are in the greater New York area have antibodies to the COVID SARS-2, or SARS-CoV-2. Now, what does that mean? That's the problem. We don't really know. What we know is that probably 20 to 25% of people have been exposed to the virus, but we don't know how long that immunity will last. We don't know even if there is immunity to it. And what does that mean for the rest of the country? Well, overall in the country, we've had about 50,000 deaths, and about 10 million people have probably been exposed. So that is the little dot right there. There's about 325 million people in the country. So if you look at it from that standpoint, this big red box is how many people are in the country total. And in order to get herd immunity, so herd immunity is how many people have to be unable to catch the disease. Now, it doesn't necessarily mean they've had it and they're immune. They also may not be catching the disease because they're sheltering, because they're staying away, because they're keeping out of the mix. But the math of this depends on how many people are infected at each time. You've heard this by now if you're at all interested. So it's called the R naught, which is an R0. And the best estimates right now are that the R naught for COVID is about 2.2. So if the R naught were 2, then 60% of people would have to be immune or unavailable to be infected. If it is 3, then it's more like 75 to 80%. So let's assume at 2.2 that we need to have about 65% of people immune or unavailable to get infected. So that would be about 220 million people. That is a lot. And the problem with the 220 million people is that if we have the same death rates that we did, so far with 10 million people exposed, we have 50,000 people who have died. If we have 220 million people who need to get infected to be immune, that's 1.1 million people who die. So it's a choice. But there are a couple things about the herd immunity that are worth saying that are positive. One of them is that, remember how I said it's not just people who are immune, it's people who can't catch the disease. So this means that if we all are aggressive about proper mask wearing and hand washing, that actually limits the number of people that can get infected, and that may mean that our effective R naught is down to like 1.7 or 8, in which case we just need 50,000 people, and we need 50% of people. So wearing masks is still an important part of slowing out herd immunity. The other part of herd immunity is that if we assume that you get immune for any period of time, then the slower we go and the slower we have people acquiring immunity, the longer we will be able to stretch it out, because we don't want everyone to catch it right now and then the immunity may go away in a year or two. So then we're doing all of this again. The longer we wait and the slower people catch it, the better. So again, social distancing to the extent you can is still a really, really good idea. And the final thing about herd immunity is that the longer we wait, the more likely we are one thing we know is we already are wanting to put people on ventilators later, and we're already changing some of the settings with ventilators. There is a study that came out of Cuba this morning that the lead author put information on a listserv I'm on, and surfactant, what they give babies in the NICU. Surfactant is a soap that can kind of hold the bubbles in your lungs open, the air bubbles, and it seemed to have a very good effect on their critically ill people in Cuba. So that paper should be up in a day or two so that scientists can look at it and peer review it and say, yeah, but this wasn't great, or oh, this is really promising. But it's the kind of thing like that, like nasal rinsing, like various different vitamins. Those are going to have solid data around them within the next few months. So if we can just hold off on expanding this bubble for a couple months, we're going to have some answers, and it's going to be fine, and we'll have fewer than 1.1 million deaths. Okay, it's going to be better than that. But for right now, it does feel awful if you're on the front lines and you feel like your government is letting you down, and that you're not valued, and that you're not protected, and that you know you don't have enough N95 masks, and yet people are going out on beaches and they're going to be infected, and in 3 weeks you're going to have 20% of them that are coming to your emergency room. So for that feeling of being overwhelmed and justifiable anger and scared, there is a wonderful link that has been shared for free that we're going to put up, which is from resilienceandprevention.com. And it's 3 separate mindfulness and meditation exercises that are expressly put together for being resilient, for not feeling anxious, and for feeling hopeful and feeling able to go back into the fray. So we're going to put that up on our website, and that will hopefully help with some of the fear for our healthcare workers. Overall, I very much hope that the warmer weather does decrease spread some. We've talked about the fact that countries that are in the south do seem to have lower rates of transmission and lower overall death and case rates. I definitely hope that all of you are able to get the checks deposited that you need, that your employers are able to hire you back, that the PPP money is working. I was very impressed with the fact that Harvard and Shake Shack and now even Ruth's Chris are giving the money back so that small businesses can have it where they need it, and we can all help each other out. Try to buy something from a small business. Try to support small businesses. Try to tip extra hard if you're able to when you go out to eat. All of these things are going to be part of our new normal, and I think that we're going to make it. It is going to be fine.